Mr. Itis? Arthritis? Hey there, it's Dr. Craig with Evolve Chiropractic. So today we're going to be talking about arthritis. Raise your hand if you have been told that you have arthritis. A lot of us actually have been. If we go to our other doctor and they look at our x-rays, they say, well, there's some arthritis here. So what is it? Arthritis actually stands for inflammation of a joint. So how does that happen? Well, to understand that, we need to understand the mechanics and basically the anatomy of the joints themselves. So the discs that sit in between our bones are actually fluid-filled spaces. When we move, those fluid-filled spaces, those discs, actually act like a sponge. So they compress, they squeeze out some fluid, and they open up, and they allow nutrients and more fluid to come in. Sounds great. Now the problem is that if we start to get restrictions or subluxations in those joints, meaning they don't move the way that they should, we lose that ability to squish some of that fluid out and then accept new nutrients in. And what happens is over time, those will start to degenerate and start to decrease in size, essentially because they become stale. Now what happens is as those start to degenerate, it changes the pressure on the bones themselves. When you change pressure to bones, what happens is your body's going to decide to adapt to that pressure. And so your body is going to try to harden up that bone to prevent fractures or other types of injuries. And when the body applies new bone to existing bone, it doesn't do so in this nice smooth pattern. It always does so in this nice jagged type of appearance. So if you, or maybe you've seen an x-ray that looks really jagged and it looks really gnarly, what happens is that bone is just adapting to the pressure changes that are there. If you've already had those changes in your spine, unfortunately, most of those are permanent. It's permanent damage to your spine. The goal with people that come in and they have significant arthritis is not to change that, it's to stop that from getting worse, to prevent that from getting worse. Now, if you are somebody who has not been told that you have arthritis, getting checked out and making sure that you have great spinal mobility is going to go a long way in helping to prevent that. So come on in, get your spine checked out. We'll see you soon.